Welcome to week 12. We're covering chapter 12, cancer. What is cancer? Cancer is the abnormal, uncontrolled multiplication of cells, which is, if left untreated, can ultimately cause death. Cancer is responsible for almost 1 in 4 deaths in the United States, and it is the second leading cause of death after heart disease. So tumors are the mass of tissues that serve no physiological purpose, also called neoplasm. So there's different types of tumors. We have the benign tumor, a tumor that is not cancerous, malignant tumor that is cancerous and is capable of spreading. A malignant tumor can invade surrounding structures, including blood vessels, lymphatic systems, and nerves, as well as distant sites via blood and lymphatic circulation. Lymphatic system is a system of vessels that return proteins, lipids, and other substances from fluid into the tissue to the circulatory system. So I would definitely remember the differentiation between the two different tumors and the lymphatic system for the exam. Every case of cancer begins as a change in a cell that allows it to grow and divide when it should not. A malignant cell divides into new cells without regard for normal control of mechanism. And this is just, in some cases, a gradual multiplication, um, which leads to abnormal cells or even a tumor. And eventually it produces a sign or system that can be detected. Few cancers, like leukemia, cancer of the blood, do not produce a mass but still have rapid uncontrolled cells proliferation. Three different development of tumors is in the first one we have an altered cell and then a hyperplasia, and then over time new mutations may rise and cause more cell proliferation. Hyperplasia may or may not lead to cancer. After additional mutations, the descendants of the altered cell may be abnormal in shape, called dysplasia, and dysplasia may or may not develop into cancer. Over time, the affected cell may become more abnormal in shape and behavior. In situ cancer is diagnosed if abnormal cells are found only in the location they first formed. The tumor may remain in this location or may acquire additional mutations. So that is how the tumor gets developed. Just because the tumor is getting developed, it doesn't mean it will do anything, but in most cases, you do want to remove the tumor because it could spread. And then we have the localized invasive tumor, which goes into lymphatic vessels and blood vessels. And then also the tumor spreads, so it can shed malignant cells into the blood or lymphatic vessels. These cells travel to distant sites and establish new tumors through the body. So you really want to localize it and remove it before it gets to spread all over the body, because then it's much harder to remove and keep it under control. Metastasis is the spread of cancer cells from one part of the body to another, just like we saw in the picture before. Early detection is critical, just because before they do move, then over here would be an easy treatment. When they do move and spread around the whole body, it will be very hard to control. So tobacco use actually is responsible for 32% of all cancer deaths, including 83% of lung cancer deaths for men and 76% for women. Tobacco use also linked to cancer of the larynx, mouth, pharynx, esophagus, stomach, pancreas, kidney, bladder, and cervix. Diets high in fats and meat that is red, processed, or charboiled may contribute to colon, prostate, or stomach cancer. Certain types of fat may be riskier than others. Alcohol is also associated with increased incidence of several cancers. Alcohol and tobacco interacts as risk factors for oral cancer. So, fun fact, cooking with foods at high temperature increases risk. And when muscle meats are cooked at high temperatures, different types of cancer causing chemicals can form in that meat that were not previously there. Diets low in fruit and veggies are absent qualities that may act against cancer. Some components may prevent carcinogens, substances that cause cancer, from forming. Carotenoid, a new group of yellow to red plant pigments that can be converted to the vitamin E by the liver, may act as an antioxidant or having other anti-cancer effects. Phytochemicals are naturally occurring substances found in plant foods, so anything green, and fiber, a significant component of fruits and vegetables, may reduce risk of cancer. Physical activity reduces the risk of many types of cancer. The ACS recommends maintaining a healthy weight throughout life by balancing caloric intake with physical activity. Being overweight or obese is linked with increased risk of several kinds of cancers, as are excess abdominal fat and gaining weight, which by now would make many connections in between this and different chapters. The role of DNA is just the double genetic substance, and chromosomes, the thread-like bodies, cell nucleus that contain molecules of DNA. We have 23 pairs of chromosomes, which you should know from biology, and gene, a section of chromosome that contains the instructions by making particular protein the basic unit of heredity. So DNA mutations in cancers. A mutation is any change in the makeup of a gene. Some mutations are inherited, some are results due to people's environments, some are caused by mutagens causes cancer, so high fat foods such as meats. Genetic changes contribute to cancer, involve photooncognate genes, which become oncognate genes involved in transformation of normal cell into a cancerous cell. Tumor suppressor genes, repair genes. Some substances accelerate the growth of cells. This means there is less time for a cell to repair the DNA damage caused by other factors. Estrogen, which stimulates cellular growth in the female reproductive organs, is an example of cancer promoter. Rates of cancer have declined among all U.S. racial and ethnic groups in recent years, but significant disparities still exist. No single genetic, socioeconomic, or racial or ethnic factor in cancer incidence or death is easy to isolate. However, people of low socioeconomic status are more likely to smoke, abuse alcohol, eat unhealthy foods, and be sedentary. And people with low incomes also face healthcare access barriers such as diagnostics and treatment delays. Ingested chemicals, some food additives are potentially dangerous, including the nitrates and the nitrates found in processed meats, environmental and industrial pollution. There's about 2% of cancer deaths are caused by general environmental pollution. Exposure to carcinogens materials in the workplace is a more serious problem. Radiation, all sorts of radiation are potentially carcinogens. Successful efforts have been made to reduce radiation needed for mammograms, which you get and for women at 40 years old, dental x-rays, and other necessary medical imaging. Care should be taken to avoid excessive exposure to sunlight. Microbes, about 15 to 20% of the world cancers are caused by microbes. So these are HPV and the Epstein-Barr virus. So 1.7 million Americans are diagnosed with cancer, and more than 600,000 die. So at current rates, more than one third of Americans will develop cancer at some point in their lives. Lung cancer is the most common cause of cancer death in the United States. So speaking of lung cancer, the chief risk factor is tobacco smoke. When combined with other carcinogens, the risk increases dramatically. So, secondhand smoke also increases the risk. Persistent cough, chest pain, or recurrent bronchitis may be the first indication that you might have lung. So the way it gets treated is chemotherapy. This is treatment of cancer with chemicals selectively destroy the cancerous cells. Only about 15% of lung cancer patients are alive 5 years after diagnosis. We also have colon and rectal cancer. This is the majority of colorectal cancers are diagnosed with people age 50 and older. Many cancers arise from pre existing polyps. Many others may be due to inherited gene mutations. But of course, obesity, processed meats, red meats, refined carbs, and simple sugars, excessive alcohol consumption, and smoking are all associated with risk. Symptoms include changes in bowel habits and bleeding from the rectum. A test called colonoscopy allows the colon to be examined and polyps to be removed. Surgery is the primary treatment method, unless it's too late. We also have breast cancer, which is the most common cancer in women, but also not always. There's also men who have breast cancer, it's just less talked about because women, 1 out of 8 women will get breast cancer, and 1 out of 38 will die. But it really occurs very rarely in men. Risk factors include strong genetic factor as well as early menstruation or late onset of menopause, having no children or having the first child after the age of 30, current use of hormone replacement therapy, obesity, and alcohol use and smoking cigarettes are all risk factors for breast cancer. So, estrogen is the common element in some risk factors. Estrogen really promotes the growth in tissues such as the breast and uterus. So, increased exposure may raise the risk. Fat cells produce estrogen. Alcohol can increase estrogen in the blood. Some studies have also shown that current users of oral contraceptives have higher risk. Important lifestyle risk that can be controlled is a low fat diet, vegetable rich diet, exercise regularly, limit alcohol intake, and maintain a healthy body weight. There's different types of detection. So, first, you'll get a mammogram, which is a low dose X-ray. The ACS no longer recommends breast self exams or clinical breast exams, although some doctors still do. Women should be familiar with their breast, alert their healthcare provider if any right away. There's also biopsy, which is just a removal of small piece of the body tissue that needs to be diagnosed. Ultrasonography is the imaging that is an audible high-pitched sound and is bounced off the body structures to create an image on a monitor. So if you find lumps, lumps can be scanned and due to ultrasonography and biopsy to check for malignancy. If a lump is cancer, several surgical treatments may be used. There's chemotherapy, radiation. There's also several different drugs that have been developed for preventing and treating breast cancer. If patients discover these lumps early, 98% chance of surviving more than 5 years is. Prostate cancer is the most common cancer in men and the second leading cancer in death in men. Age is the strongest predictor, so about 60% of cases is diagnosed with men over 65. Prostate-specific antigen (PSA) blood test is also one of the measures to test your blood. Treatment is usually removal of the prostate. Small or slow-growing tumors in older men may be treated with watchful waiting. Other treatments involve a lot of different surgical treatments by using hormones, external radiation, chemotherapy, cryotherapy. So there's also cancers of female reproductive tracts, so cervical cancer. Those usually frequently are in men in their 30s or even sometimes 20s. It's largely due to HPV, which is sexually transmitted infection. A pap test every year would determine if you have precancerous cells.
Oh, sorry.
Abnormal cells are removed surgically or destroyed them. Alter cold probe localized laser treatment. A vaccine for HPV strains linked to most cervical cancers is available. Cancer of lining of the uterus most often occurs after age 55. The risk factors are similar to those for breast cancer. Uterine cancer is usually detectable by pelvic exams and is also treated surgically by radiation, hormones, or chemotherapy. Ovarian cancer is rare compared to uterine cancer, but it does cause more deaths. It's often diagnosed late in its development. Lowering a woman's lifetime number of ovulation cycle reduces the risk. Symptoms is bloating, pelvic or abdominal pain, difficulty eating or feeling full quickly, urinary problems. It is treated by surgical removal of ovaries, fallopian tube. Skin cancer is the most common cancer. It's linked to exposure of UV radiation from the sun. So you have the ultraviolet radiations, which is a specific wavelength emitted by the sun. Most UV rays are blocked by the ozone layer in the upper atmosphere. Melanoma, which is a malignant tumor of the skin that arises from pigmented cells, usually a mole. Basal cell sarcomas and squamous cell sarcomas account for 95% of cell cancers. We have the basal cell sarcoma, cancers of the deepest layers of the skin, and squamous cell sarcomas, which is in the surface layers of the skin. Melanoma is the most dangerous skin cancer because it spread really rapidly. To protect yourself from it, there is sunscreen is the most useful tool. Head and neck cancers, so cancers that we described about the oral cavity, pharynx, larynx, nasal cavity, and that are traced to cigarettes, cigars, or pipe smoking, the use of spit tobacco, excessive consumption of alcohol. HPV infection is linked to cancers of tonsils and tongue. Head and neck cancers are twice as common in men and occur most frequently in men over 40. Chemotherapy, radiation, and surgeries used to treat head and neck. Testicular cancer is relatively rare, but its most common cancers among age 20 to 35. Regular self-examination can help in early detection. Tumors are treated by removal. If tumor has spread, you need to have chemotherapy. A 5-year survival rate is 95%. Also, other cancers include pancreatic cancers. It's usually well advanced, well detected. There's no effective cure available. Also, bladder cancer is 3 times more common in men. Smoking is a key risk factor. Unfortunately, kidney cancer usually occurs in people over 50. Smoking, obesity, family history, and mild risk factors. Symptoms. Usually, you're very tired, you're in pain in the side, and blood in the urine. Brain cancer, commonly developed for no apparent reason and can arise from most cell types found in the brain. Ionizing radiation is a risk factor. Some brain tumors are curable by surgery or by radiation and chemotherapy, but most are not. Leukemia cancer of the white blood cells starts in bone marrow but can also spread to other organs and the central nervous system. Lymphoma is a form of cancer that begins in the lymph nodes, then may spread almost to any part of the body. Self-monitoring is the most first line of defense, so you want to be aware if any changes and really report it to a physician. To treat tumors effectively, physicians need to know the exact size and location, confirm the type a biopsy may be performed. Physicians then classify the disease according to extent of the cancer, which has invaded nearby lymph nodes and whether metastases are present. Classifying the staging. So this is the different stages of cancer. So 0, you're just have abnormal cells. 1 to 3 is higher number indicating more extensive disease, and 4 is the cancer that spreads distant tissues and organs. In many people, cancer is treated with surgery, chemotherapy, and with other drugs, radiation usually work for many cancers, but it's not always true for some. There's also immunotherapy.